I'm Dr. Diana Kerwin. I'm an internist and geriatrician. I've been working in the field of Alzheimer's disease diagnosis and management for 20 years. I think with regards to the biomarkers have evolved just like anything else in Alzheimer's research. And the biomarkers initially were really, how accurate. So if we're talking about biomarkers, talking about amyloid PET imaging, potentially tau PET imaging, and then also plasma-based biomarkers and spinal fluid-based biomarkers or CSF-based biomarkers. And really they were used in the original or some of the early research to identify, first make the right diagnosis. We do know that although Alzheimer's is the most common cause of dementia, it's not the only cause. So biomarkers, even still today, although we put a lot of emphasis on biomarkers for the early detection of Alzheimer's changes, amyloid and tau-based changes in CSF, blood, PET scanning, the biomarkers today still have a role in differential diagnosis. There's still cases, we currently have biomarker studies that are ongoing now that are still identifying patients that potentially were diagnosed clinically with an Alzheimer's type of dementia syndrome that the biomarkers actually do not really hold that up. But we now know that there's a new classification status that you can look at of a non-amyloid based Alzheimer's dementia. But there is something to be said for the biomarker still being applied in some of those cases where potentially there's a differential diagnosis that includes more than one dementia syndrome and being sure that you have the right patient. The biomarkers still in the symptomatic patient, even as we have disease-modifying therapies come out, and I know initially we're focusing on early disease states for disease-modifying therapies. Patients in the early stages of Alzheimer's disease still will need to have the identification of amyloid status, and so we'll need to have a biomarker profile made in order to still be sure you have them in the correct setting, you have in the correct diagnostic box. The correct classification of their disease, and then also then applying the correct therapies as our disease-modifying therapies evolve, being sure that we don't give a patient with Lewy body disease a medication that's really disease-modifying for Alzheimer's or vice versa. So I think that still remains an issue. For the later stages of Alzheimer's disease, where we're really, if I still think, again, being sure that patient's been appropriately identified or classified with biomarkers, have they been just as we appropriately like to classify them in their clinical condition, what exactly are the domains that are being affected by their cognitive impairment? What is the functional impact of their cognitive impairment? What's the behavioral symptoms that they're experiencing? What's their home life or family setting? And all of that needs to still be well-defined in order to apply or provide the right resources, treatment plan, symptomatic and disease-modifying therapies for those patients. So there is still somewhat of a role. I think the role for biomarkers becomes a little bit less important as we get to the later stages. But I do think as we're learning now about how to apply disease-modifying therapies, that there's likely still going to be a role for a good period of time, again, to be sure that we really have a good biomarker profile of patients as we do add in more therapies.